Hi, this is Dr. Tajkarimi. I am a board-certified urologist in the Washington, D.C. area. I have the honor of having Dr. Robert Valenzuela, the Director of Prosthetic Urology at Mount Sinai University in New York City. We are both prosthetic surgeons. A large portion of my practice is helping men with erectile dysfunction, especially men who suffer from severe ED, where the blood flow to the penis is impeded, or they cannot maintain erection due to venous leakage or a combination of both. In these cases, your options are limited, and if medications such as Viagra, Cialis, Levitra, or Stendra don't work, or you do not wish to do injections or injections are not working, then your options are limited. We highly recommend that you study what a penile implant is, discuss it with your physician, and meet with a sexual medicine specialist such as Dr. Valenzuela, whose majority of the penile implants in New York City are performed by him. What an honor to have you here today.
It's my pleasure to be here. It's great. A nice conversation about penile prosthesis surgery and how we can help our patients.
Penile prosthesis was invented in 1973, and it has gone through generations of improvement, and I'm really happy with what we're doing now.
Yes, I think we're getting very good results. I think the durability, the ability to place it in a cosmetic approach, almost scarless approach, in the way that you can't even see any of the components, any of the tubings, where patients feel like they're very comfortable with the appearance and function of their penis.
So penis has two compartments called the corpora that have to fill with blood. If blood flow is impeded, or the blood doesn't want to stay in those chambers of the penis, think about penis being like a pool that has to fill with water. And if those chambers do not fill adequately, then the procedure of penile prosthesis is where we surgically place two cylinders that fill with saline to create a natural erection, just like a normal erection. And the procedure takes about 45 minutes to an hour, and sometimes it can be done under local or IV sedation, and it's an outpatient procedure. In the past 40 years where this device has been around, even in the past 2 years to 3 years, we have been able to almost completely eliminate infections because of the new irrigation fluid that we're using called Ericept. What are your thoughts about what we have done in the past decade to make this device very safe?
I think the expansion of the cylinders has been extremely important. The ability to regain some of that girth in the penis, that's important. The pump mechanism itself, now we have what's called lockout valve. We used to have a complication or a complaint of some of the patients that the penis automatically would fill, or during sexual activity would empty. The introduction of the two lockout valves in the Titan prosthesis, it's a huge benefit. That's number one. Number two, you also have a coating on these prostheses that will coat the prosthesis with whatever we wish to coat it with. And so Ericept has become essential. It's a non-antibiotic irrigant, so we don't have to worry about, getting bugs that are resistant to it. And it basically maintains the implant nice and clean. We put it in, and our infection rates are very low. We actually claim in my practice our infection rate are about 0.7%.
Wonderful. Who is the candidate for penile implant, Dr. Valenzuela?
I think you covered it pretty well. We're talking about guys who show up who have erectile dysfunction, difficulty maintaining an erection, even with medication. They don't want to use injection, or if they use injections, the injections cause them pain, and they're just very dissatisfied with the sexual life. Yeah, some of the medication may give you an erection of what we call erectile hardness of about 5 out of 10 or 6 out of 10, or they lose their erection during sexual activity. This is all related to a venous leak. And venous leak, unlike in the heart where you have a problem with the arteries of the heart where you can easily correct those, in the penis we can't do that. And so the penile implant really fills in that space. And one of the misconceptions is like, well, am I going to feel anything? Am I still going to have an orgasm? And yeah, what I tell my patients is all this does is give you the rigidity to be able to have intercourse. It does not interfere with your sensation, does not interfere with your orgasm, does not interfere with your ability to ejaculate. And if placed properly by the right surgeon, Your partner may not even know you have an implant. The pump can be placed in a position that not even the partner can detect where the pump is, which is very important.
A key question that I ask patients when I'm interviewing them is, when was the last time you had penetratable erection? If it's more than 3 months, and if the patient has a partner, that patient is suffering from severe ED. I have patients come in, they're in their mid-50s, and they're like, I haven't been able to get penetratable erection in 8 months. I'm embarrassed. And actually, I avoid my wife because if I'm approaching her and I cannot get a good erection, then I feel so disappointed. This issue is a global issue. More than 40 million Americans suffer from erectile dysfunction, and I think maybe 15 to 20% have severe ED. Yeah. And the numbers are mind-boggling. What are the causes of ED?
If we start with the basics, right? We have hypertension. Well, let's start from the top down. You have stress. If you have a very stressful life, your erectile function does suffer because you're so stressed that you may not be able to function. Hypertension, all kinds of medical problems, hypertension, diabetes. There's type 1 and type 2. And while we think of erectile dysfunction as a problem, but for older men, patients with type 1 diabetes begin to experience erectile dysfunction in their 20s. I've implanted a guy as young as 26 years old with a very poorly controlled type 1 diabetes that he lost his sexual function, total erectile dysfunction, because of his poor control of his diabetes. So diabetes is a big one. High cholesterol, obesity, lack of exercise, all these things can affect your erectile function.
Absolutely.
It's all very common.
Performance anxiety. Patients who failed maybe a couple of times, now they have lost their confidence. And this may be correctable with psychotherapy. Sex therapy could be corrected with an oral medication trial. But if you are persistently unable to get adequate erection, you should have a procedure or a diagnostic study called penile duplex ultrasound, which is typically performed by urologists who do sexual medicine. It's a quick procedure where we inject a medication in the penis to provoke an erection. It's completely painless. And what we do is we study the blood flow in and out of the penis to identify the cause of why you're not getting the adequate rigidity. And this procedure can really determine whether you're a good candidate for penile prosthesis. Penile prosthesis is not the last option. I mean, this is an old school way of thinking. Oh, everything fails. Now I'm 75 years old. If you're in your 50s and you want to live with 20, 30 years of excellent sex life and you have tried oral ED medications, do not wait any longer. See a urologist and find out if you're a candidate for penile prosthesis. Can you tell us why this is a problem?
In terms of patients feeling
patients
like
waiting for years and years.
It all depends who you see, right? If you don't see a sex med specialist, someone who really focuses on it, everything that we do is based on your confidence level. If you're confident about the services that you're offering to your patients and you know that you're going to have very good results, you're more likely to offer it, and you're more likely to treat your patient as a whole. But if you're uncomfortable about your surgical skills, about what you do, or whether an implant is the right thing or not, you're less likely to offer it. You know, just to add a little something to diagnostic, duplex is great. Some guys don't want to come in and have an injection on their penis and be checked out. We used to do what's called Rigiscan. Remember that? That was old time. Rigiscan involved putting a device on your leg and a device on your penis and measuring overnight. Now we have something that patients can monitor themselves, something called a FirmTech ring, that they can go ahead, put it on, connect it to their phone, and it's like a Fitbit for your penis, where you can tell what your erections are at nighttime, what your erections are like during sexual activity. It's amazing. You can actually see how hard you get, and after an orgasm, how intense the orgasm was, all from a Fitbit for your penis.
Both of us are also Penuma surgeons, which is a penile enlargement. We're one of the 10 urologists in the world who offer this amazing procedure. We are always asked, what is the best way I can preserve my length or my girth? When patients develop erectile dysfunction and they're not getting the adequate nighttime erections to deliver nutrients and oxygen to the penis undergoes what we call atrophy, which is loss of tissues, smooth muscle. And you can actually lose length of your penis from just having ED. I see a lot of patients in my practice who say, Doc, I used to be 6-7 inches erect length. Now I'm less than 5.5. So loss of erect length can be due to not being able to get nighttime erections. So if you have severe ED and you're in your 50s, waiting 10 years to get a penile implant will potentially shorten your penis. We as surgeons, we can only put what fits in your penis as in the implant stage. We cannot oversize you. There are some maneuvers we can do to maybe get some additional length, but in general, we can only put what fits in your penis.
And I think one of the biggest complaints from some of the other from patients related to penile prosthesis is loss of penile length after the prosthesis. Well, guess what? Like you said, most of these guys have waited 10 years. They've waited too long, and by the time they come in, it's not the erection they remember. And so that's a big problem. It's not related to the surgical intervention. It's related to the amount of time that you waited to get your implant. So, in my practice, my motto is size matters. And my idea is to try to help you restore the loss of length associated with long-term atrophy. But that's the key word there is restore. We're not going to enlarge the penis. We're not going to make it bigger. All we're trying to do is help you get something of what you've already lost. But yeah, waiting a very long time, definitely detrimental to the function of the penis and the size.
So a typical experience of a patient going to a high-volume prosthetic urologist like Dr. Valenzuela or me is, it's an outpatient procedure. You will typically be able to activate and start cycling your implant by compressing the pump in the scrotum. It's almost invisible incision. The incision is not even visible after several weeks. And typically, you will be able to have excellent penetratable erections for as long as you wish 3 weeks after surgery, which is unbelievable, where I have patients come into my clinic with their wives. They haven't had sex in years, and then I see them in the clinic. They look like they're they just came back from their honeymoon with smiles on their face and changed lives. It's incredible.
Absolutely. Definitely. It's, and I say, him, but it's actually for both of you. And a big thing about my practice, and I tell my patients is, you say you're doing this for your wife, but the reality is you're doing it for yourself. We're driven by testosterone. Did you know that about 10 to 15% of men who get an implant never use it on a partner? But you ask them, would you do it again? 100% of them say they would do it again. And you know why that is? Because they've lost that fear. They're no longer avoiding sexual encounters or areas where they may become sexually active because they're confident. They get their confidence back. They know that they can get an erection. They know they can function on the spot. And that in itself can be really, really powerful.
An average erection is about 3.5 minutes before you have an orgasm. With a penile implant, you can last as long as you want. You can continue to have orgasms. It doesn't change your sensation, your orgasm, your ability to urinate, to ability to experience pleasure. So I myself, if one day I develop erectile dysfunction, I will be getting one from Dr. Valenzuela next morning.
And I'll be visiting Washington, D.C. for mine. Absolutely. I'm a true believer.
If you're interested to learn more about penile implants, please visit my website at penileimplantdc.com, or you can visit Dr. Valenzuela's website
At Valenzuela Urology.
Again, thank you so much for spending time with us. We love to offer you our opinions about different urological issues. Please look for us in our Instagram and websites and YouTube in the future. Thank you so much.